Thank you so much for joining us. I am Dr. Darvish here at Holy Speak Naturopathic Medical Center. And we have been doing these webinars, Zoom webinars every week. Some of them you will find on drdarvish.com. If you go there either under media or under blog. So it's a combination upload on those. And then every Thursday we do an Instagram and a Facebook Live. Instagram is on my Instagram, dr.darvish.nd, and Facebook is on Holistic Medicine, Holistic Naturopathic Medical Clinic. So, very excited to have two of our wonderful doctors here today. We will be talking about sleep. And Dr. Julianne Murella, she's just finishing up her second year residency with me, and she is both an acupuncturist and a licensed naturopathic physician and a licensed massage therapist. So she has it all in her pocket. Mm-hmm. And her specialty is chronic diseases, women's health, GI disorders, physical and sports medicine, IV therapy, and integrative primary care. So that's Dr. Murella. Very grateful that she's with us. She's a Bastyr graduate. Dr. Paroo is also a Bastyr University graduate who's been practicing for about 18, 19 years. And I'm very excited to have her be part of our Holistic family. She specializes in chronic disease and drainage, is a primary care physician, and loves to work with cellular detox and lifestyle medicine as well. And she also does IV therapy. So welcome to the two of you, and let's take it over for sleep issues. Thank you so much, doctors.
Thank you, Dr. Darvish. Okay, sorry, I'm having a little technical difficulties, the theme today. Okay, well, hello everyone. Thank you for joining us today, and thank you for taking the time to listen to us. And so today we are going to talk about sleep, and my name is Dr. Julianne Murella, and I will just go ahead and start. Nina, before I get started, can we take turns as people come in? Never mind. I don't think you can mute people as people come in. That's okay. No worries. I'll figure it out. Okay. So
Julianne, if you go to the participants and mute all, I think you will be able to mute everybody, but you might need to admit them in as well.
Oh, wow. This is really...
But then you might mute me, so I don't know.
Okay.
Well, then you can unmute yourself.
We'll figure it out. Okay, so today we're going to talk about sleep. So Dr. Darvish did a great job of introducing me and Dr. Paroo. So again, I'm Dr. Julianne Murella. I am a naturopathic physician as well as a licensed acupuncturist, and I'm often combining Western and Eastern medicine in all of my patient care visits. Did you want to say anything else, Nina?
No, not really. I'm Dr. Paroo. I've met a lot of you folks that are on the call, and we're just excited to share information with you today.
Yeah. Okay, so the first slide here is just sleep on it. So I was just recently listening to a podcast with Joe Rogan. He was interviewing Matthew Walker, who is a neuroscientist that just studies sleep. Maybe some of you have heard it before, but they talk about this phrase, just sleep on it. And this is a phrase that we often say to people when they're having a hard time making a decision or having a hard time dealing with something. We just say, just sleep on it, you'll feel better tomorrow morning. And usually they're right. And this is actually a phrase that transcends different cultures, different languages, and it really speaks to the value that we put on sleep. And in many different cultures, this is shared. We all understand that sleep is really important to our cognitive performance and with just everyday life and making decisions.
So the question of why we sleep, the answer to that question, is not as clear as one would think. And there are various theories about why we sleep, but the basic biological need for sleep remains unclear. One theory suggests that it's for energy conservation because during sleep, our overall energy metabolism is reduced by as much as 10%. In times past, this would allow us to conserve resources during the part of the day when it wasn't the best time to hunt or search for food. Another theory suggests sleeping gives us the opportunity to repair and regenerate and restore what was lost during the time when we're awake. And to me, this is the most compelling reason, as it suggests a biological advantage to the behavior. There's been studies showing animals suffering from complete sleep deprivation will lose all immune function and die in a matter of weeks. So when we sleep, what's happening to our physiology? Even though there is not a lot of physical activity and we appear to be sedated, there's actually a lot going on behind the scene. Again, this is a time when our body has the opportunity for repair. Sleep has such positive effects on so much of our internal function, and here are some of them that I'm going to share with you now. So our immune system releases signaling molecules called cytokines that help with fighting infection and reducing inflammation. We secrete more growth hormone from a gland in our brain, which helps with cellular growth and repair. Also, a major stress hormone, cortisol, reduces during the first part of the night's sleep, giving our nervous system a break and shifting towards more of a parasympathetic state, which further allows for tissue repair. There's relatively new research on the glymphatic system in our brains, which is basically the continuation of the lymphatic system in our bodies. This is a waste clearing system, and it's more active when we're sleeping than when we're awake. And one of the really interesting things about the glymphatic system is that it clears beta amyloid, the protein which is implicated in neurodegenerative disorders such as Alzheimer's. There's also the consolidation of memory that occurs during the different stages of sleep. Both our fact-based knowledge and as well as our procedural knowledge and recall are improved and supported by sleep. This reinforces the idea that that all-night cram session before an exam instead of sleeping is ultimately not going to help you. Research supports that not getting adequate amounts of sleep will shorten your lifespan. Therefore, it makes sense that getting enough sleep will increase your lifespan because it makes you less susceptible to chronic disease. A lot of us who are looking for a way to manage weight need to know getting adequate sleep is a must. This is because sleep deprivation alters hormones that control hunger and satiety, influencing our food choices during the day. Next slide. So now that we've looked at some of the health benefits of sleep, it's equally important, if not more important, to talk about the ill effects of sleep deprivation. In North American culture, there seems to be a badge of honor worn by people who claim that they don't need a lot of sleep. Common sentiment is that sleeping is a waste of time and a sign of laziness and non-productivity. Unfortunately, this is really misguided. The first studies on sleep deprivation were published in the second half of the 19th century, showing prolonged sleep deprivation and insomnia can provoke severe psychic disturbance like delirium, hallucinations, and emotional disruption. More recent studies and sleep research have expounded on these findings, and we now know that the effects of sleep deprivation or inadequate amounts of sleep have far-reaching systemic health consequences. There are many consequences of sleep disruption and deprivation, some of which are obvious and some of which are more insidious. For example, many of us have experienced feeling more on edge or not being able to handle stress as well after a night of poor sleep. Unfortunately, what we don't often consider is the downstream effect of chronic sleep deprivation and its contribution to chronic disease. Next slide. So to revisit what is happening internally when there's sleep disruption and disturbance, actually that's in a couple slides from now. This slide I should have gone to previously. It's just reinforcing that there's short-term effects of sleep deprivation and then the long-term effects there. So the short-term effects, increased stress responsivity, body pain, emotional distress and mood disorders, having trouble with memory, and having trouble with performance. And then the long-term effect, which again is more insidious, and we sometimes don't put two and two together, but having sleep deprivation and sleep disturbance are risk factors for cardiovascular disease, high blood pressure, imbalances in your cholesterol and other lipids. It's a risk factor for type 2 diabetes, weight-related issues, neurodegenerative disease, and cancers. Next slide.
Okay, so in the next few slides, I'm going to highlight some really cool studies that I found about sleep and how certain things. Like in this study, they talk about sleep deficiency and motor vehicle accidents. And so in this study, they followed a large group of people. It was like 2,000 people, both male and female, for 2 years. And some of them had sleep apnea and some of them did not have them. And so they monitored them for 2 years, looked at their sleep and how much they were sleeping, and also looked at their driving history. And what they found was that people who had severe sleep apnea, they were associated with 123% increased crash risk compared to people who did not have sleep apnea. And sleeping 6 hours per night was associated with a 33% increased crash risk compared to sleeping 7 or 8 hours per night. And so what they concluded here is sleep deficiency due to either sleep apnea or insufficient sleep duration is strongly associated with motor vehicle crashes in the general population. And in this next study, I found this one really interesting. So they talk about shift workers and how different start times will affect your sleep. And I'm sure some of you have actually noticed that maybe during this shelter in place, you're getting a little more sleep because you're not commuting. You literally just wake up. Hopefully for some of you, you wake up and you move to the office or wherever you're doing work from at home. And so in this study, they looked at 44 different pilots and they had them work 4 different work shifts. So the baseline was a mid-morning shift, and then the other ones that they compared to the baseline, which were early morning shifts, late evening shifts, and an afternoon shift. And so they found that pilots lost sleep if they worked the early morning or late evening shifts. And non-traditional work shifts contribute to sleep deficiency, and maybe this should be taken into account in certain industries. And they even talked about how because people are losing sleep, that maybe some industries should also provide some fatigue risk training. And so reading this study, I started thinking, like, what are the factors that affect my life and everybody's everyday life in terms of sleep? And so one of them, which I just touched on, is commuting. So let's just say, you know, you're starting at 8 o'clock in the morning. For those of you who have to commute an hour, let's say, you have to wake up just a little bit earlier to make time for, you know, if you're eating breakfast in the morning, but also making time for that hour commute. And so that's going to cut into your sleep time. And then let's talk about commuting after work. So let's just say you get off at, you know, a regular time, maybe 5 or whatever, but let's say you still have that hour commute. I mean, maybe even longer, depending on what traffic is like in the evening. But that by the time you get home and maybe pick up your kids and or eat dinner, it's pretty late, and that's also going to cut into your sleep time. So they found that in this study, non-traditional shifts encroach on an individual's sleep opportunity, and such shifts should be a contributing factor to a high prevalence of sleep deficiency observed in modern society. And so in this next study, they talked about sleep hygiene in recovery for athletes. And so they looked at how sleep and how much sleep is important to muscle recovery and athletic performance. And so the negative effects of sleep deprivation were they saw a decrease in strength and power, and athletes tended to feel depressed, confused, and fatigued. And they saw this amongst athletes that were only sleeping 6 hours, or even, like, obviously with 2 hours you would experience this as well. But the positive effects of sleep extension were, in college students, they found that they had a better reaction time and they were a lot more alert. They even found that naps, they improved cognitive performance, tasks, sprint time improved, and short-term memory improved. And the thing that came up in this study that I was reading is they highlighted how this affects kids. So a lot of kids, they're involved with extracurricular activities and, they're balancing their homework. And because of all this, they might be losing sleep. And so I thought, like, this is something that we should also try to reiterate with our kid athletes, is trying to convince them to get to bed on time and make sure that they're sleeping a full 7 to 8 hours. So now I'm going to get into the stages of sleep, and this is something that we cycle through every 90 to 100 minutes, and your brain waves that you experience when you're sleeping are different from when you are awake. And so stage 1 and 2 are generally your lighter stages of sleep, and so stage 1 is your light sleep. It's the period between when you're awake and when you're falling asleep, and this usually takes about 5 to 10 minutes. And then in stage 2, you're falling into a deeper sleep, and this is when your heart rate and your body temperature starts to drop. And this lasts for about 20 minutes. Then stage 3 is the transition period between your light and very deep sleep. And then stage 4 is when we start to really get into this deep sleep, which lasts for about 30 minutes. And then your REM cycle, so REM stands for rapid eye movement. This is when we start dreaming. So this is when our brain is actually the most active during sleep. And this is also when our voluntary muscles are paralyzed. So essentially you're not really moving. And this occurs after about 90 minutes of sleep. And so we usually see sleep movement disorders like sleepwalking around stage 4. And in stages 3 and 4 is when we are getting our slow wave sleep brainwaves. And I'll talk about that in more specifics in the next slide, but those are the brainwaves that are important for cognitive performance. So now in the next few slides, I'm going to talk about certain things that affect sleep and what hormones change while we're sleeping. And so generally we know that marijuana and alcohol help us fall asleep. And so with alcohol, it's helpful with sleep latency, so the time that it takes us to fall asleep when we are drinking alcohol acutely. And so not chronically, right? So maybe just one night. And we also see that it decreases our REM sleep, which is our deepest stage of sleep. So chronically, meaning you're drinking it quite a bit, maybe every night, we see that, it increases our sleep latency. And so it's actually not helping us fall asleep quickly. It's doing the opposite. And it's also affecting the time that we are spending asleep. It's decreasing that total sleep time. And we see that it also decreases the slow wave sleep brain waves, which I talked about. It occurs in stages 3 and 4. And so those slow wave sleep waves are good for cognitive performance, memory, and learning. And so if we're losing that, then we're losing the time in our sleep where we're working on our cognitive performance, our memory, and our learning. And so also it increases our sleep fragmentation, which is when we switch from light to deeper stages of sleep. So that means you're waking up more frequently. However, the good thing is that we see that there is improvement in all of these markers when we stop drinking. Marijuana is very similar, except it's not the usage of marijuana that affects it, it's the discontinuation of marijuana. And so in the beginning, yes, it does help with falling asleep, but we see that when you discontinue using marijuana, it causes a decrease in sleep quality, insomnia, and most often it causes very strange dreams. And people will start complaining of the strange dreams part even just a day after stopping smoking. And we see that in chronic users, it loses the effects of decrease in sleep latency. So you're actually not falling asleep very fast anymore. And we see that there's an increase in slow wave sleep, which is a good thing. So you are getting the benefit of increasing your cognitive performance, memory, and learning, but you're also, it's taking a while for you to fall asleep. But we do see that withdrawal causes an increase in sleep latency. So when we stop smoking marijuana, then it increases the time that you are actually falling asleep. And so the way that I think about this and the way that I look at marijuana and how it affects our brain and our sleep is that, marijuana, it does help us fall asleep initially, but as we chronically use it, and then we discontinue it, it's as if our brain is craving for that drug. And so then you start experiencing these symptoms like a decrease in sleep quality, insomnia, and strange dreams. And you also have a longer time until you fall asleep. And so now I'm going to talk about melatonin. So I think we often have heard of this as something that helps us fall asleep. And so the source of this is the pineal gland, and then also the gastrointestinal tissue, if and so you are taking it orally. And so melatonin causes drowsiness, and it also decreases body temperature. And so I'll show you a figure in the next slide, but melatonin is highest in the middle of the night, which makes sense, because melatonin is helping us feel drowsy and it's helping us stay asleep. And so Dr. Paroo will go into the effects that it has on leptin in the next 3 slides. But essentially, as melatonin increases, leptin will increase. And this is the hormone that inhibits appetite. So if you're not sleeping very much and your melatonin is low, then leptin is going to be low. And that's when we're not having any inhibition on our appetite. And you might see binge eating or frequent eating or overeating. And also melatonin is an antioxidant. And so it's actually at higher doses, it can also be very effective as an adjunctive cancer treatment. And so melatonin is increased by darkness, which makes sense because it's highest in the middle of the night. It's increased by stress. It's also increased by high levels of exercise. And it's also increased by serotonin and 5-HTP. And serotonin and 5-HTP increase melatonin in that they are precursors that lead to melatonin in the biochemical pathway. Things that decrease melatonin are ultraviolet light, sunlight, and artificial light. So here I want us to think about our blue light. So our blue light that's coming off our computers, our phones, when we use that in the middle of the night or before we go to bed, it's actually decreasing our melatonin, which then can cause insomnia or an increase in that time, the sleep latency, the time that it takes for you to fall asleep. Other things that decrease your melatonin are EMFs, so microwaves, TVs, video monitors, and X-rays, magnetic fields, so magnets and MRI, and aging as well. So cortisol. Cortisol is often referred to as our stress hormone. It's secreted by our adrenal gland and our GI tract. And I think in a few presentations before, we talked about how there is a certain area in the gastrointestinal tract that makes cortisol. And so, as I said, it's often referred to as our stress hormone. And when it's elevated, it can suppress our immune system and can affect our glucose levels. And I talked about it specifically in the HPA axis. So this is something that gets activated when we are really stressed. And so when we're really stressed, our hypothalamus will then trigger the pituitary and then the adrenal glands, and the adrenal glands will then make cortisol. But cortisol is not actually all bad. So it actually helps us wake up in the morning. And this is called the cortisol awakening response. So it starts to increase 30 minutes after you wake up. So in this slide, I'm going to talk about how cortisol and melatonin, how they change throughout the day. So our circadian rhythm. So cortisol is this black line and melatonin is this red line. And so cortisol, as you can see, it starts to rise right in the morning. This is our cortisol awakening response. And throughout the day, it should decrease. And then again, it goes up again once you wake up the next day. And melatonin is the opposite. And so, as I said, it peaks in the middle of the night, so here and here. And then as we wake up and go through the day, it's at its lowest, and then it starts to rise again at 9 o'clock. And then it peaks again in the middle of the night. And so I want you guys to pay attention to this part where cortisol is supposed to go down. Things that affect our cortisol are pituitary gland and adrenal gland issues, steroids, so if you're taking any steroid medications, estrogen and hormonal imbalance, as well as stress can increase your cortisol. And this can be any stress. It doesn't have to be emotional. It can even be exercise. So oftentimes we're telling patients to not work out in these times, so between or right after work, and that's because it's because if you have a spike in your cortisol, so it goes up, then you're not going to feel as sleepy. You're going to feel kind of really juiced, and you might have a really hard time falling asleep. Yeah, and then with melatonin, so remember I talked about blue light. So if we are watching TV or we're on our phones around this time, so right before 9, or anytime really, but if we are on our phones right before we're about to go to bed, you will see that this melatonin will start to decrease, and you won't actually have it increase, and that won't make you feel as drowsy, and you might feel a little restless. You might feel a little, or have some difficulty falling asleep. Dr. Paroo, I don't think you're unmuted.
Here I am. Okay. Okay, so now we're going to revisit what's happening internally when there's sleep disruption and disturbance. And so the left-hand side of the table there is talking about the physiologic effects which lead to the short-term and long-term consequences of sleep disruption and deprivation. So at the top there, it's speaking to our stress hormone secretion becoming dysregulated, which is what Dr. Murella was speaking about, meaning that there are certain stress hormones which are rising when they should be falling, and having them rise is going to contribute to the overall increase in sympathetic tone. There's disruption in our circadian rhythm, or which is another name for that is our internal clock. Some of our hormones related to our metabolism, which is the leptin and the ghrelin, and that influences our feelings of hunger and satiety are interrupted. And so what happens with that is that it makes you make different choices potentially the next day when we're trying to make decisions about food. Because if your appetite is not suppressed, then you potentially are going to eat more than you would if you were getting proper sleep. Our immune system produces more inflammatory molecules, and there's a drive towards more oxidative stress. And lastly, there's an interruption in melatonin production and secretion, just as Dr. Murella was speaking about. And all of this over the long term, over time, can ultimately disrupt and damage our DNA, increasing our risk of chronic disease. Next slide. So there are many risk factors that influence our ability to sleep, as we all know. What we eat and what we drink, the type of work that we do, travel, can all contribute to how well we sleep. There are, so that is talking about the lifestyle piece of things. And then there's the environmental, which is basically excessive noise, light, or extreme temperatures. I think that the biggest one that we usually have to deal with is the excessive light. I mean, there's just so much light pollution in today's environment. Uh-oh.
Sorry.
That's okay. And then there's sleep disorders. So insomnia, obstructive apnea, restless leg, narcolepsy, circadian rhythm disorders, all of those are going to be risk factors for having sleep disruption. There's medical conditions. So if you have an underlying medical condition, that can contribute to having problems with deprivation, sleep deprivation and disruption. And then lastly, the psychosocial, which I think in my patient population is probably the biggest one, where there's excessive rumination and worry and anxiety, which is contributing to challenges with sleep. But then, you know, if you have trouble or you have challenges in your life with young kids and or caring for family members that have chronic illness, whatever the stress is, it can contribute to have problems with yourself sleeping at night. Next slide. So insomnia, I wanted to speak to insomnia because it is, out of the 100 sleep disorder classifications, insomnia is the most common. And so I wanted to speak to this a little bit more. And so it's defined as, well, chronic insomnia is defined when there's difficulty falling asleep, so taking half an hour or 30 minutes or longer, staying asleep during the night, so sleeping in bed for less than 6 hours, or waking up more than 3 times a night. And to be considered chronic, it needs to be occurring for, 3 months, at least 3 months, 3 times a week. I said that backward, but you get the picture. 3 nights a week for 3 months. It has a significant financial impact, interestingly enough, because of loss of productivity at work, which makes sense. If you're tired, it's like you're just not going to perform as well at your job. And so therefore, you're gonna compromise potentially what is happening in the workplace. As Dr. Murella mentioned, it's also a major contributing factor to death by car accident, with people falling asleep at the wheel or having decreased reaction time due to poor sleep. And there are various reasons for insomnia, and while it can be a primary disorder, meaning like there's no underlying condition as to why it's happening, it's more common that there is an underlying condition that's contributing to it. So I consider it actually more of a symptom rather than a disease. And we really encourage folks that are suffering from insomnia, or any sleep disorder for that matter, to seek counsel from their healthcare provider, because it has such far-reaching effects emotionally, physically, and even socioeconomically. Next slide.
Okay, so I'm going to talk about the traditional Chinese medicine perspective of insomnia or sleep deprivation. And so in Chinese medicine, there's a few things that can affect your sleep, and that can be disturbance of the spirit, or the shen is what it's called in traditional Chinese medicine. And this can be caused from an excess or a deficiency of heat. And so as we age, so there's yin and there's yang. And so our yin is our cold energy, and our yang is our hot energy. And you want a balance between the two. And as we age, that yin starts to deplete. And so then we have an excess of yang or hot energy. And so some women can experience this from hot flashes. Some people can also get night sweats. And then an excess of heat can be caused from a poor diet. So maybe we're eating a lot of spicy food, greasy food, fast food, and this can cause an excess of heat. Other reasons in Chinese medicine are qi and blood stagnation, which can be caused from trauma or some injury. And so you could have pain that's keeping you up at night. And it also can be from stress. And so when we are emotionally stressed, our qi and our blood stagnates. And we often know that stress can keep us up at night. And so another reason is a deficiency in your yin, blood, and your jing. And so yin is thought as being your cold energy, but also the fluids in your body. And then there's blood, and then jing. Jing is the essence in that you're born with. And so as we age, your yin and your blood deplete. And in a chronic illness, you can see that yin and your blood will also deplete, and hereditary factors can cause a deficiency in your jing. And so as an acupuncturist, there's a few things that I would ask about in terms of your insomnia if I am taking a Chinese medicine approach. And one of the questions is, what time are you waking up? And so if you look over here, you can see that every organ has an element, but it also has a time. So oftentimes when people are stressed, they usually are saying that they're waking up between a certain time, and that time is usually liver time, so 1 to 3 a.m. And the reason for this is when we are emotionally stressed, your liver in Chinese medicine is what absorbs all that stress. And so oftentimes we'll see that when people are really stressed out, they will wake up between 1 and 3 a.m. It could even be a little before or a little after. Other questions that I would ask would be, are you having trouble falling asleep, or are you having difficulty staying asleep? And if you're having trouble staying asleep, it could be from that stress. So what we call liver qi stagnation. So when we're stressed, our qi gets stagnated, but then our liver absorbs all that stress. So it could be from that. If you're having a hard time falling asleep, it could be from heat, too much heat, disturbing the heart or the kidneys, and causing you a hard time to fall asleep. Another thing could be dreams. So I'd ask you about, are you having vivid dreams? If you're having vivid dreams, then that's stress. If you're having busy dreams, that could be heat in the heart. Another thing would be, are you remembering your dreams? And when you can't remember your dreams, we think blood deficiency in Chinese medicine, because there's not enough blood to nurture your brain, and thus you can't remember your dreams. Another thing we talk about is digestion. And so in Western medicine, we think if you eat too much right before bed, you kind of feel like a blob, and you feel like the food is sitting in your stomach while you're trying to fall asleep. And in Chinese medicine, we think of dampness. And so your spleen is your organ that's in charge of digesting your food, but it's also in charge of digesting and getting rid of that dampness. And so if you're not having if your digestive system is not as great, then we would look at tonifying and supporting your spleen, and also eliminating damp foods, which could be like sugary foods, fast foods, greasy foods. And then I'd ask about mood. So we talked about stress. And then night sweats. So are you having night sweats? And that could be a sign of yin deficiency. And then I'd also look at your tongue and your pulse. And so in Chinese medicine, every organ has a certain spot on your tongue. And so we look at what that area looks like. We also look at whether there's any teeth marks, what the shape of it is, whether there's a coat on it, if there's any distension of the veins. We look at all that to see if that can give us a deeper look into what is going on. And then we also feel for your pulse. And so every organ also has a position in your pulses. And so we feel for the quality, how deep it is, how fast it is, how slow it is. And this will also give us another picture as to what is going on. So I put this slide here because I just thought it was funny. And I think it's a good way, it's a good segue into what we're going to talk about next, which is what are things that we can do to improve our sleep. So this is a cartoon with a patient telling her doctor about her insomnia, and she said, and her doctor says, insomnia is very common. Try not to lose any sleep over it.
So before we get into ways to improve your sleep, I just want to talk about some common myths that are out there, and we've hopefully debunked them in this talk already. So the first one, it's okay to get by on only a few hours of sleep. I think we've been talking to you for maybe 30 minutes, and I really hope that you know that this is not true at this point. A night or two of not getting adequate sleep, one could usually get by with that, but this is not a long-term plan. A nightcap will help you snooze better. So some folks like to have a post-dinner cocktail, and as Dr. Murella suggested, it might help you fall asleep faster because it acts like a sedative, but because it reduces your REM or your rapid eye movement sleep, we miss out on that deep restorative sleep. And the more you drink, the less REM sleep you get. Myth number 3, snoring isn't harmful. Light snoring could mostly be harmless, but loud snoring can actually be a sign of sleep apnea, which is a sleep disorder consisting of pauses in your breathing. And chronic loud snoring can indicate that the airway is being blocked at night. Sleep apnea affects the quality of your sleep, and so if you are snoring loudly and you're suffering from fatigue or sleeplessness during the day, those symptoms together could mean that you have it. There are sleep studies that your provider can send you for to diagnose this, to determine if this is happening for you. And the last myth, it's possible to catch up on missed sleep over the weekend. We all wish this is true, but unfortunately it isn't. So when you miss a full night's of sleep, and you do that many days in a row, there's something called sleep debt, which accumulates. And many people believe that you can catch up on this on the weekend by sleeping in. And unfortunately, this is not how sleep debt works. You can never really catch up for the sleep that you've lost. You'll always be in somewhat of a deficit. But it does give you some type of reprieve or restoration, at least symptomatically, if you can sleep in on the weekends. I just think that, it's not a long-term plan. Next slide. Okay, so here's a laundry list of ways to improve your sleep, and we're going to go through most of them. So the first one is exercise, and I think we alluded to this before, that the time that you exercise is important, because if you exercise too late in the day, it can be seen as a stress on your system, increasing your cortisol, and that can prevent sleep. So it's recommended, if you have sleep challenges, to exercise earlier in the day, because that's going to help you with not having sleep problems at night. Avoid sugary or grain snacks before sleep. This is because it can potentially raise your blood sugar and inhibit sleep. And then later, when your blood sugar drops and your blood sugar might get too low, that's going to wake you up and you might not be able to fall back asleep. Avoid foods that you might be sensitive to. This seems to be especially true for wheat and dairy. There's no rule around that. It just seems to come up clinically a fair amount. And that's because, or eating foods that you're sensitive to can contribute to sleep apnea, excessive congestion, upset in your digestive system, and many other interruption in your physiology, and that can interrupt your sleep. Avoid caffeine. So some people do not metabolize caffeine efficiently, and so it can sort of stay in their system for longer than they think, which can interrupt sleep at night, or interrupt or challenge your ability to fall asleep. Usually we see this with people that have caffeine sort of after 12 noon. And so some people can get away with that morning cup of coffee, but if you're having sleep challenges, it would be good to investigate to see if you can't have any caffeine at all. Avoiding alcohol, and we've talked about this a few times now, but it makes you drowsy, but it often makes you wake up in the middle of the night, and it prevents you from falling into the deeper stages of sleep. This list is really not very fun. It's like, we're not letting you do anything, but if you have sleep challenges, it's such a common experience for people that most people will try anything in order to get that good sleep back. So eat a high protein snack before bed. This can help provide L-tryptophan, which is an amino acid which is needed for melatonin production. Don't drink any fluids within 2 hours of going to bed. And the reason for this is, if you're finding yourself waking up at night and having to urinate, it's helpful to pull back the time of when you stop drinking fluids, because that can potentially help you not wake up in the middle of the night to urinate. And then right after I say that, I'm telling you to drink something before you go to sleep. So if you don't have a problem with waking up during the night to urinate, you could try drinking some milk, and it doesn't have to be dairy, it can be a plant milk, and putting some spices in there, so saffron or nutmeg or cardamom, because these can be helpful for relaxing an overstimulated mind. Taking a hot bath or shower or sauna before bed, what this does is going to have a reflex action of bringing blood from the periphery. It will bring your blood to the periphery, and it will lower your core body temperature. And this can be helpful to bring sleep on, because if you have a higher core body temperature, that can be difficult. It can provide it to be difficult for you to fall asleep. Getting to bed early. So our systems, particularly our adrenal glands, do the majority of their recharging and recovering during the hours of 10 and 12 a.m. Also, as Dr. Murella pointed out, from a Chinese medicine perspective, your gallbladder dumps toxins during 11 to 1 a.m. So if you're awake, those toxins can back up into your liver and then secondarily back up into your entire system and cause further sleep cause further disruption in your health. And honestly, before the widespread use of electricity, people would go to bed shortly after sundown, as most animals do. And really, that's probably what we should still be doing. Be consistent with your sleep-wake times. So our bodies really like routine. The more regular you are when you go to sleep and when you wake up, this lowers the amount of stress on your system. And so you don't have to go to bed every night exactly at the same time and wake up exactly at the same time. But if you can keep that within an hour or so every day, it's really going to be helpful for your overall rhythm of getting into sleep. Sleep in complete darkness, or as dark as possible. So when the light hits your eyes, it disrupts your circadian rhythm and the production of melatonin from your pineal gland, which we've already discussed. And so the goal is to be able, to not be able to see your hand in front of your face because it's that dark in your room. And also, if you get up in the middle of the night, try to use as little light as possible. No TV, computer, electronic device usage at least 1 hour before bed. And also allowing, or just keeping your bed for sleeping, because along with the light that is stimulating from your devices, it's just stimulating to have that input from our phones or our electronic devices, which can sort of rile you up and make it be longer for you to fall asleep. Reading something spiritual or relaxing before bed. This also gives your body the signals and your mind that it's time to wind down and relax. And reading something stimulating or watching something stimulating is obviously going to have the opposite effect. Some people do well with journaling. If you can't seem to turn your mind off, going to pen and paper and just writing out your thoughts to get it out of your mind can be helpful for some. Wearing warming socks to bed. So this is a treatment that we use with a variety of people and conditions, but it can be helpful for sleep initiation if you're having trouble with that. So what you do with this treatment is you get your feet really hot with warm water, whether that's by a shower or a bath, or just sticking your feet under the tub sink or the tub faucet and getting your feet hot with the water. And then you get a pair of thin cotton socks, you run it under cold water, wring that out super well, put that on your feet. And I hate being cold, and I will do this treatment. So there's no excuses. You can do it. And then you put your wool socks over that, and then you go directly to sleep. And it seems to be helpful for increasing your circulation, and it will also help with reducing waking up at night. There's a technique from Ayurvedic medicine using sesame oil and massaging your feet and your hands, because sesame oil is very balancing to a Vata dosha type, which is the dosha type that is most overstimulated and kind of needs the most calming effect from any way that one can get it. So that sesame oil massage can basically relax the nervous system. Checking your bedroom for electromagnetic fields or EMFs, because this can disrupt the production of melatonin and serotonin. Keeping the temperature in your bedroom no higher than 70 degrees. And a lot of people keep their bedrooms too warm or their houses too warm, especially in the winter, and that can interrupt sleep initiation. Avoiding the use of loud alarm clocks. Obviously, this has nothing to do with sleep initiation, but it's just a stressful way to wake up the body in the morning. And if you're getting enough sleep, you actually might not even need to use an alarm clock. I mean, that's kind of a good litmus test to know if you are getting enough sleep. I'm sure most people don't set alarm clocks on the weekend unless you have somewhere to go. But and if you wake up sort of naturally in that way, it's kind of a good indicator that you are getting enough sleep. And then lastly, losing weight, because if you're holding extra weight, this can increase your risk of sleep apnea, which will also prevent a restful nights of sleep.
So I put a list, or we put a list of some supplements and botanicals or herbs that can help with sleep. And obviously the first one here is melatonin, which is what we talked about, but melatonin can actually be helpful in, it's helpful in helping you fall asleep, but it might not be as helpful with staying asleep. But it is actually helpful with dealing with jet lag. So you would take the melatonin about 30 minutes or an hour before you should be falling asleep. And this should help you get used to whatever time zone you're in. And then there's 5-HTP and serotonin, and we talked about how these two are actually precursors to melatonin, and that's why it's helpful with sleep. There's magnesium, as magnesium is really helpful in calming the nervous system, as well as GABA. And then there's nervines, which we have mentioned, and nervines are the type of herbs that help calm the nervous system. And so those herbs are lavender, kava, avena, and then ashwagandha can also be helpful in lowering your cortisol levels. It's an adaptogen, so it helps you adapt to stress. And a lot of these are actually found in our supplements. Two of them in specific, which I'm sure some of you have already taken, called Chill Pill and Sweet Dreams. Other things that are helpful are acupuncture. So we talked about how that helps. Homeopathy can be very helpful with sleep deficiency. Hyperbaric oxygen therapy can also be helpful. And I saw a research study that specifically talks about how this is helpful for insomnia in children who have cerebral palsy disorder, and IV therapy can also be helpful. And this can be helpful because you're getting some nutrients intravenously that can help calm your nervous system, like magnesium. And so we've come to the end of our slide set. And so this is the time in which you guys can talk, can ask questions, and you can unmute yourself. Or you can just write us a chat, and we can answer that question there. Thanks, everyone.
Hi, I did have one quick question. You mentioned a Joe Rogan podcast at the beginning. Could you say who that was with again?
Oh, it was with Matthew Walker.
Matthew Walker, okay.
Yeah, it's no longer on the, like, you know, when you go to the Apple podcast and you try and look up all the previous episodes. So it's so long ago that it's no longer there. So you have to, I just YouTubed it. So if you just YouTube Joe Rogan, Matthew Walker, you can find it. It's like episode 1109 or something like that. And he also has a really great book too called Why We Sleep. That one's really, really good. So.
Okay, great. Thank you.
Yeah. Any other questions?
Great, Dr. Dr. Murella and Dr. Paroo. Sorry about that.
It's okay.
Thank you so much. That was a great, great presentation. really enjoyed it. Hopefully everybody did and learned something from it. Tomorrow, we will be doing an Instagram and Facebook Live between me and Dr. Marion. So if there's any questions that come to your mind, you're welcome to come on and ask those questions. Otherwise, we will see you next week. And next week, we will talk about epigenetics, racism, and trauma and stress, and how we can change all that, because a lot of that does get passed on from generation to generation. So it's a very fascinating topic, and it applies to all of us and any of us who are going through any kind of stress or emotional stress. So do join us next Wednesday webinar, and the link will be sent to you on Monday or Tuesday through your newsletter. Thank you again, Dr. Murella and Dr. Paroo, and everybody out there. We will see you next Wednesday. And keep in mind, by the way, that anything that we have said is for informational purposes. So please do seek either one of the physicians here or your own provider for more specific treatments and conditions. Take care and have a great, great week. Bye-bye.